What's happened here is I just got an adjustment in my neck. My neck just cracked. So it's realigned itself a little bit better. And it should be, yeah, it's a lot smoother now. Hello, everyone, and welcome. I'm Dr. Rob Vanbergen, and we are here today to talk about little wings for today's 10-minute training. Now, this is a protocol that kind of gets a bit of a bad rap among some people because they struggle to pull it off, or they just don't like how it feels. But it's a very important one to kind of learn because it can do a lot from a practitioner's perspective in actually benefiting the body. So I'm going to introduce you to little wings today. And this technique is really designed to alleviate neck and shoulder tension, which is a very common issue in our modern tech-driven lives. So in this session, we're going to explore what the little wings protocol is, and we're going to talk about its role within our pain resolution protocols. We're going to show how it addresses common ailments. We'll talk about the ailments it addresses, and we're going to work through the process to actually perform this protocol. And it's simple, though it requires a little bit of wiggling around to often find the right spot. So by the end of this training, I hope you'll have a clear understanding of how to implement this protocol to promote relaxation, to improve posture, to enhance the well-being of your clients. So let's take a look. So Little Wings uses, well, let's talk a little bit about why it matters, because many people suffer from text neck or tech neck. They get tight shoulders, tension headaches, nerve compression, all from poor posture. And this is because we're often looking down. When we look down, even just a little bit, we add many pounds of weight of pressure on our spine. And this causes a lot of discomfort that our body has to adapt to. So these issues aren't just uncomfortable, but they can lead to very long-term structural and even energetic imbalances within the body. So this is where Little Wings comes in. It's a simple protocol that has a lot of benefits. First off, it reduces neck and shoulder pain for your clients. So almost immediately, right? It's not invasive. It's going to just help to release that shoulder tension. It will improve mobility and range of motion in the upper body. When someone can't turn their neck all the way to the side, this is a great one to loosen these things up. And it works on the shoulders and the arms too. If people can't extend their arms properly, it's going to be able to help with that. It alleviates tension headaches and migraines. This is kind of my go-to when I start to get a headache, is to do this, because if it's muscular, this is what's going to provide some release, especially if you've got a lot of stress, because that's where you're going to feel that stress is in your neck. It releases muscle tightness, and it ultimately helps to balance the nervous system. There's a very small amount of vagus nerve stimulation that happens from this. It's obviously not an ideal replacement for it, but it does help to relax the body. And it does support posture correction as well. It'll address the imbalances of the muscles. I know we have our full realignment protocol, but to be honest, this is a great way as well of creating some pretty quick relief for someone in getting that posture corrected. And it will help activate the natural healing response of the body because the electrical signaling is going to get in there, get some inflammation down, and it's also going to draw in circulation and blood flow to the area. Now, what we're going to be doing is to apply the protocol down here along the neck. And ultimately, we need a few tools to do this. Now, any one of our Avazzia Life devices, so this wouldn't include our Avazzia Blue because it doesn't have the right mode, but our Avazzia Genesis 2, our Evolution, our Genesis, the original one, or the Pinnacle are all going to be able to do this protocol. And to me, it's an incredibly accessible and effective protocol. It takes about 40 seconds, really, to get this done on any patient that's coming through the door. It's pretty quick. So as long as you can start to master it, it's something that you can start to incorporate in most protocols for most clients. So let's take a little bit of a look at this protocol. So today I'm going to use my Life Evolution with a Y probe. Now, I can't think of a tool that works better for little wings than a Y probe. It doesn't matter if it's the 6-inch or the 8-inch Y probe, but there's not really one that I would say does the same thing because you almost need to get the muscles straddled along the electrode here. So in order to do that, you're going to need something that has this spacing. So we used to do little wings with the electrode built into the back. It's just not something that we do anymore. I wouldn't really wish that upon anyone. It's already can be challenging enough to find the spot. Now I'm going to demonstrate this on myself, but I hope you can see how this works on a person as well. Now what you're going to do is you're going to place the electrode behind the ear, so flush up like this. So you should be able to see that. You're going to set the device by pressing your mode button to 121. Now this is the same, and hopefully we can get this to focus a little bit here so you can see. Come on. Nope. Okay. Well, it's on 121, and 121 is the mode that modulates. This is going to be the same in all the devices. This is what it is called. Now, it modulates 3 to 1, so it's 3 seconds on and 1 second off. And the important piece here is that that is going to pull on the body and drop it. So you want to warn your patient that they might experience some loss of control of their shoulders, as you're going to be able to manipulate them without them necessarily wanting to go along. They shouldn't resist. We don't want them to hold back and tense up. We want them to just relax. So what we're going to do, the next step here is we're going to drag this electrode down the neck and into the shoulder area here. So we should be flush somewhere in this region. Then we're going to hold the plus button down with decently firm pressure here on the neck until we start to feel a pull. Now, if we're feeling a tingle and we're not getting the pull, what we're going to need to do is slide that electrode back a bit. There it is. Okay. So it's always about finding that spot and holding it in place. And your patient's going to feel kind of a pulse, like a tug up, and it's going to be about 3 seconds. And then it's going to drop. 3 seconds. And sometimes it's going to be slower than others, and other times it'll be more abrasive. Okay. Now you want to get 5 flaps. So in this case, I just got 5 shoulder lifts, like I'm flapping my wings, right? So then we're going to switch to the other side. Now here, because you've already got the power up, what I tend to do is not put pressure up behind the ear, but just hover above it and pull down to try and find the right spot. I'm a little bit off. I can feel it there. Okay. Now, in this case, I'm actually not getting the lift that I usually would get here, even though I can tell I'm in the right spot. Sometimes with little wings, you have to press the power up higher. Oh, starting to feel it. So you need to, there we go. It needs to go a little bit above comfortable in some cases. So what this will do is you can see it can get a little bit more intense. This is why people don't like it, because it can be pretty aggressive as it pulls. However, it's releasing that tension. It's going to feel afterwards, it's going to feel good. So that's 4. 1 more. 5. Okay, so now that's normally all we do. 5 flaps on each side. You want to make sure you do both sides because you don't want the person to end up out of alignment. However, in this case, with how aggressive this side was and how gentle this one was, I feel, and I'm going to use my instinct here, that I need to do another 5 on this side. So what I'm going to do is I'm going to go back here and I'm going to get back to this spot. And I feel like I need to increase the power. So it feels like what's going on is, and this is kind of something you'll learn as you feel it. When you're getting that resistance, there's probably some inflammation or some weakness here. And I actually did hurt this shoulder recently. So I'm going to need to push it higher. So I'm going to increase the power. And it's not comfy. This is one of the protocols where it's acceptable to go above comfortable. There we go. There we go. Okay. So what you have to kind of figure out is you want to get that kind of same tension as you go. There. Okay. And so what just happened here is I just got an adjustment in my neck. My neck just cracked. So it's realigned itself a little bit better. And it should be, yeah, it's a lot smoother now. And it actually it's not too strong anymore. Okay. So because I've done 5 on this side, and 10 on this side. I do want to go back and do another 5 on this side. Ooh, hello. You see how rapid that was. It's 2, 3, 4. Last one's coming. It'll all be over. 5. Okay. All right. So there's a part to this that we're teaching here because this is for professionals that's different than when we're doing this at home on ourselves. Usually, we're just like, get your 5 flaps and it's going to be fine. But when you're dealing with a patient, you only get to see them every so often. You want to make sure you take full advantage of that. In this case, when one side required much more power to get any movement than the other, and this side felt such a weak change versus this side, it was very important to me to make sure I got that adjustment. There was something that was out of alignment. Now, in this case, what happened is I got a crack here at the back of my neck, like a vertebrae kind of slipped back into place. It realigns your sphenoid bone. So it's actually realigning your spine and your skull into a nice, comfortable position where it wants to be. So I kind of wanted to accept that treatment and get it done. Just happened to be that apparently I needed it more than I thought I did. So keep that in mind with your intuition, looking at how you can expand protocols to incorporate additional treatment time if needed, but always making sure to keep that balance here, right? We needed to do it on both sides so that we don't end up being out of alignment. By doing 10 on one side, I've essentially overtreated one and under the other. So by making it match, even if it was a little bit uncomfortable, I've optimized the therapy and made sure that I'm not going to be out of alignment more on one side than another. All right, so a simple protocol, incredibly useful to master, and I think incredibly simple to begin with. But it's one of those things I do know a lot of people struggle to get the lift on themselves, sometimes on their patients. So I would keep practicing. Keep experimenting. One of the most important tips with this protocol is if you're not getting the lift in the spots that you think it should be in, try moving it back or forwards until you start to see that lift. Usually it's just a slight position issue, and a small little adjustment can give you that treatment success. All right, so hopefully you found this useful. If you have any questions, as always, please drop them in the comments below. Otherwise, I'll see you next week for another 10-minute training. Take care, everyone. Bye-bye.